thank you, first of all, you for being here and for devoting your time to something very important like STIs, but not to say thanks to all the team from this conference, to Professor Ahmad in particular, to Professor Nisha Pramar, to the whole team, in Georgia included, then to my friend sitting next to Ahmad and in the first row. This is the second time I've been on this conference, but this is because, you know, this conference is famous, and the ambassadors, such as Professor Ahmad and Professor Pramar, they are known throughout the world. But then again, I've been, I think, for the fifth or the sixth time in Dubai. I've been also invited before. I had the opportunity to visit Dubai Derma and Galadaris and so on. So there is a great collaboration, and I'm very happy to be here. So I think that this session is a little bit interactive. And of course, I don't have conflict of interest. But you know, this slide just shows that if you want to make a good coffee, you make a coffee from the coffee. Without coffee, you cannot make a good coffee. Then again, STIs are usually transmitted mostly through any kind of sexual contact. But it's not necessary that we always say that to the patients, because sometimes they prefer to hear, can it be transmitted this way or the other? Then usually we all working in STIs field, we say, yes, it is possible that way. We all know that we are lying, but sometimes these lies are necessary. So, for example, in Croatia, it seems that people swim 24 hours a day, 7 days a week in a swimming pool. So they asked me, Doc, can it be transmitted to swimming pool? When I was younger, I used to answer, well, depending on what have you been doing in swimming pool. Now, I'm answering, yes, it is possible. So please, we are not inspectors, we are not policemen, we are doctors. We have to gauge the patient's history. Because if we are too ostensive, the patient will draw back and we will not get the usual history. That's important. Of course, I think that, you know, Croatia is a small country, Middle European Mediterranean country. In the case you haven't visited it, you have to correct that mistake. Well, that's what I don't like. Please, it's dermatovenerology. STIs are important part, and I don't like this dash, because this dash means it goes separately. Please don't let us lose this fantastic part of our profession. Well, mistakes happen. We should admit our mistakes, and we should learn from our mistakes. Now, by the, you know, headquarters over there, I have been informed that something now follows something which you have to scan your code if you want, if you would, because it's going to be interactively. You are all technically much better equipped than I am, so please be so kind, do it. Although they measure me from my time, I'm not so happy, but anyway, because you might, if you would be so kind, as to answer your opinion on some of the interactive things. I'm definitely convinced that you know the answers, and you are such brilliant experts. However, it's not bad to repeat sometimes these things. If you have done so, I think now we could move to the next slide, because the time is running. They will tell me you have passed your time. Can we go to the next slide? Thank you. Shukran. Now, here you see a patient with that. What is your diagnosis? So, you've got 4 choices here, and I'm definitely sure that you all know the answer. However, please be so kind and give your opinion. That's very easy for beginning. But believe me, sometimes the patients with this are very boring patients. And very, you know, they do it. Now, do I get their answers or do I get the correct answer? Yes, that's the correct answer. Now, can we see the results? They told me that they will present the results. I don't know how would they, sorry? It was the results on the screen. Oh, yeah. Oh, you are fantastic. You practically don't need my lectures. Anyway, you are excellent. Now let's go on. I don't know why. No. Even when I go here, or no, it's not good. Because even if I go on the other side, it goes here. Oh, no. I didn't know that it doesn't go backwards. I thought it will go backwards. Now, I gave you the answer, and it goes only forward. It doesn't go backwards. Anyway, I knew that you would know this. I know. Now, it will be 100%, not because of that you saw the answer, but I know that you're knowing that. It is. No, can we see the result? I can't see the result. Oh, it's still the time. Oh, okay, come on. Yes, thank you. It's like this. This might be sometimes a very annoying situation. They might get inflamed, and it's sometimes a problem. These are the both sexes. I have to control here because it doesn't go completely. Now, about oral infection, I don't think it's a question, but it's just your opinion, yes or no? No, exactly. Yes or no? No, exactly. This? Yes, exactly, that's it. It is. So, sometimes it really looks very similarly, and genital warts are comparatively not frequent in the oral cavity of the immunocompetent persons. But there are some other HPV-induced lesions which have nothing to do with genital things, like epider, some by 14 or 58, but these are not oral lesions. Now, on which picture are genital warts? C, exactly. That's it. That's it. Because, there are things like that. It's very common lesion in comparatively rare Crohn's disease, but the lesions on the genital region might be very, very expressive. Now, here, of course, the history is missing. Anyway, this is quite obvious. So, here you can use the app. So, what is your diagnosis? I'm admitting the history is missing. So, I won't tell you the secrets of the history because this is quite obvious, and this is something that we have resurgence as compared to the years before. So, I hope you did vote. And you, oh my God, no, I think our technical service has whispered you the results. So it is 100%, and I tell you why. Because today, whenever we have, it can imitate anything. They call it from the 19th century les grandes stimulatrices. But anyway, palms and soles are the clues. So, we have to ask the patients a lot of things. It's required. It is secondary syphilis, definitely. As I said, it's grand stimulatrice, so it can imitate any dermatosis. Sometimes, like HIV infection on the body, it can be like drug eruption, it can be pityriasis rosea, but rosea usually doesn't affect palms and soles, but sometimes it does, especially if it is irritant form of pityriasis rosea. So it's not, the diseases haven't read the books. So sometimes it is really irregular, but it's very like this. And Well, in some of the situations, it's not easy, because not all the patients look like the one I have shown you. Over there. Now, what's your diagnosis? It's not that obvious. Please. Sorry. I have to watch for the watch, so it's okay. Yes, but the both options are okay. The both options are okay. Because, you know, in GPs, they always think that, at least in Croatia, anything appearance on the male genitalia is fungal infection. And all the patients get clotrimazole for anything. And they adore clotrimazole. So not everything is there. Of course, if we with mycological workup, it's like that. It's definitely candidosis. Because, you know, sometimes irritant dermatitis might mimic candida infection, and it might look very similarly. But anyway, the patient always thinks it's fungal infection. Like on the nail, whatever it is on the nail, in the mindset of patients, it's fungal infection. They come to see me and they say, "Doc, I've got a fungal infection." Then I ask, "Okay, so why have you come to see me if you exactly know?" I read it on the Google, and that's what the reality is. Now, what's your diagnosis here? It's, well, I'm sure that you would guess with a great proportion. Yes, it can be the both, but it is scabies. Believe me, scabies is much more frequent than we think. It's usually always missed as allergic dermatitis, especially on the body, because the patient thinks she or he is a part of aristocracy if they have allergic dermatosis. It's entrance to the high society, where scabies is something dirty. On the contrary, a real allergic dermatitis is much more difficult to cure and to find the reason of the scabies. So think about it. And this is definitely sometimes we need to make. We do parasitological workup in our lab, in our department, so this should be. Mistakes allow thinking to happen. Scabies is much more frequent. And even sometimes, because, you know, the patients usually hide the lesions, and please beware, in adult persons, scabies and STI. Even the patient believes, I got it from the blankets, from the bed, hotel, or from the gymnasium and so on. Let them believe like that. Then afterwards, all the other contacts might be non-sexual. That's true. But it's also sexual transmitted diseases. Well, this year, we got the greatest European event. I will afterwards bring you some flyers, and it is the greatest European Conference on Sexually Transmitted Infections, held in Zagreb, in capital of Croatia, this September. So if you can do it, I would be very happy. Some of you would be there, but I would be happy if you could somehow guess, because this is the greatest European event. Zagreb is a spectacular city. It's not that famous like Dubrovnik, but it's really a pearl in Europe. And I'm still on time. You are fantastic. And by this, I wish to thank you most kindly for your kind attention. The first part of my show is finished. And from that part, shukran, thank you so much for your kind attention.